Welcome to the National Center for Rural Road Safety's December webinar. We're just going to give people a few minutes to enter the room, and then we'll go ahead and get started. All right, thank you all for joining us for the National Center for Rural Road Safety's December webinar entitled Using Data to Improve Rural Road Safety. My name is Jamie Sullivan. I am the director for the National Center for Rural Road Safety. Just have a few webinar logistics for you all. Today's webinar will be an hour and a half in length. To activate closed captioning for the webinar, you can click on the Show Captions button at the bottom of the screen. There's also an arrow there where you can adjust those caption settings if you need to do so. We are recording today's webinar for website archival, and that will be available on our website at ruralsafetycenter.org/webinar-archive within the week. We do have two ways for you to share information with us today. There is a question and answer pod that we would ask you to please use for any questions you might have. That will make it a little bit easier for us to find those at the time where we're doing questions. And you can also use that to alert organizers of technical difficulties as well. You'll also notice the chat pod so that we can share some links with you and you guys can share information with each other. As we get going today, I will post a link in that chat pod for you to be able to download the handouts for today. At the end of today's webinar, we will also have a feedback form that we would ask you to fill out. It's really helpful for us to know what additional topics you might like to see in the coming year. And then we will have certificates of completion for today's webinar, as well as applications for continuing education units. Those certificates of completion and the form to fill out for CEUs comes out about 4 to 6 weeks after our webinars. Very excited to give you a few announcements before we get started today. We have 2 brand new Home Safely podcast episodes that have been posted to our website. Episode 6 features Jack Sullivan, who is the Director of Training for the Emergency Responder Safety Institute. He talked about vulnerabilities involved with responding to crashes, methods and tactics responders use to be vigilant, and then also how Emergency Responder Safety Institute works to improve the general standard approach to responding to crashes. And then in episode 7, we feature Nick Parr, who's the director of Boone County Highway Department in Indiana. And he talks a little bit about his experience in rural road safety, how his department has evolved over the years, and how they work to implement the safe system approach. And we're lucky enough to have Nick on our webinar today as well. Our Road Safety Champion program is a Safety 101 certificate program that we have. We've just finished up all the modules for the fall, but we're going to be starting again here in a couple weeks. So our core modules will start again on Tuesdays from 1 to 3 p.m. Eastern Time, starting January 13th. Registration is open for all modules for this fall. Just a reminder, you can find the different pathways and the different module names on the website on these QR codes that are over on the right-hand side. There are a few modules that cross pathways. So our Planning and Engineering 2 is also Maintenance and Construction 2, and our Planning and Engineering 5 is also First Responder number 1. So just keep an eye on those 2 in particular to make sure you know when they'll be held if you need to take either of those. If you're looking to figure out what courses or modules you may not have taken yet, you can email us at info@ruralsafetycenter.org, and we'll provide that information to you at the beginning of January once tracking is updated from the ones we just finished now. I also wanted to remind you all that the Road to Zero Community Traffic Safety Grants are open until January 16th. They close at 11:59 p.m. on January 16th. So please take a look at those. They did hold some informational webinars, and recordings for those should be available on their website to answer any questions you may have. And then I also wanted to point out, because we're talking about data today, that the GHSA has a newer resource that they released in September on data-driven action plan for safer roads. This talks a little bit about how to use telematics and AI for data. So it's just something you could take a look at if you're interested. I'd like to also thank our co-sponsor for today's webinar, the NLTAP Safety Working Group. So thank you for doing that with us as well. And now I'm really excited to get into our presenters. Our first presenter is going to be Nick Parr from Boone County. He is the Director of Highways there. He is a lifelong resident of Boone County, Indiana. He's been on the staff at the Boone County Highway Department since 2006 after working in various roles in construction industry. Since being at the Highway Department, he has served in many roles, including driver, equipment operator, foreman, operations manager, and has been the Director of Highways since 2020. I'm going to stop sharing my screen here and allow Nick to share his and turn it over to Nick.
Okay, can everybody see my screen?
Cannot see it yet.
Okay, let's try this. Click some more buttons.
Now we can see it. Perfect. And thank you all for also introducing yourself over in the chat pod. We appreciate all of that as well.
Okay, as Jamie said, I'm Nick Parr, I'm the director of the Highway Department here in Boone County. A little background about Boone County, kind of location, central Indiana area. We're just north of Indianapolis, northwest of Indianapolis, which is the state capital. We have about 730 miles of road, center line miles of road that we maintain. A little more of it's paved than it is gravel. About 195 bridges that we take care of, a significant number of small structures. We have a county population at the last census about 80,000 people. So for a little more zoomed in, like kind of where we are, what we're looking at as far as the rural area, the colored areas on the map are the urbanized areas, or the areas that have been annexed into the cities and towns. There's a significant area of rural still exists. We battle that area that kind of transitions between the urban and the rural on a regular basis, but we're one of the fastest growing counties in the entire state of Indiana. So Jamie wanted me to talk about a little bit of the safety data and the systemic approach that we went through to determine, in our local road safety plans. I thought I'd start a little bit with why did we choose to create a local road safety plan? We have about one fatality per year on our network, and our goal is to make that zero. Sounds like it would be an easy task. You only got to get rid of one, but that has just not been the case. We're a growing county. We've had a lot of challenges with trying to get to that number. So, why did we end up going, taking the lead on this after doing the plan? A lot of these things kind of came up as we were doing the local road safety plan. But our street and highway departments, we are the front line. We are the boots on the ground that can make those changes to the infrastructure, that attempt to get the driver's attention. And we feel like we are the best suited to lead the charge to get to zero deaths and serious injuries caused by traffic crashes. So that's really why we chose to do the local road safety plan initially. So in our local road safety plan, our goals are, set goals for the top four things that we were really looking for. Find those hot spots. What could we do about it? How could we make a difference in reducing crashes at the hot spots or the areas that we're having frequent issues? We also wanted to utilize the crash data and system characteristics to identify the systemic solutions. So not just where the issues currently exist, but where they also could exist in the future as our county continues to see a population increase. We wanted to develop a long-term implementation plan, so we didn't just have we found the problem and we have a plan. We wanted to be able to work the plan, and that's where the secure or dedicate the necessary funding to actually make a difference and to implement what we had came up with in our plan. So for the purpose of today's presentation, I wanted to kind of break down how we got to the systemic part of it. This is the roadmap that Federal Highway kind of has for putting together a local road safety plan. And this is really the roadmap that we were able to use. So we didn't have to reinvent the roadmap. We were able to just follow along. So in this presentation, I want to talk about the safety data, and maybe a little bit more zoomed into that is even just the crashes and the maintenance logs that we use to collect the data to get the systemic part of this plan kind of established. So to do that, we had to, we had to utilize some of our resources. We have in Indiana, we have local technical assistance programs, very well funded, very engaged, helps us out quite a bit. And they took the data, which is all inputted when there's a crash, into one system statewide that we know as ARIES, Automated Reporting Information Exchange System. And it's a giant database that collects all the information that is inputted. And then Laura Slusher from LTAP was able to uh, take that data and help us split it apart and get it down to something a little more easier to digest that we couldn't have done on our own. So I want to give her credit for that. She was going to be part of this presentation, but wasn't able to make it fit in her schedule. So she is definitely the one to help do this next part that I'm going to talk about. It was not Nick Parr at the Highway Department being able to do this work. So let's see if I can move on to the next slide here. There we go. So the first thing we did was collect the crash data. It was combined or merged with other data that we were able to provide to the LTAP group. Pavement conditions, so all of our roads are assessed annually for condition rating. We took our geometrics of our roads, so you see the horizontal and vertical curves. The crash locations had to be cleaned up. Many of the crashes may not have been put in exactly at an intersection or at the exact location where the crash actually happened. So there had to be some cleaning of the data to make sure it was geolocated correctly. We also used the speed limits, so that would help determine where we may have different issues that we could address. Our sign inventory is collected via GIS, so we were able to provide shape files to combine with all the other data. Traffic counts were included where we had them. We don't have traffic counts on all of our roadways. Some of our very rural roadways, we don't have specific counts, but can, estimate a lot of those. And then the paved or unpaved surfaces were also included in the data analysis. So for our data set it included 988 crashes that were just on our jurisdiction roadways. So we excluded municipal streets, NDOT, federal highways, any state roads are all excluded. In Indiana, we don't have separate township roads, so the county takes care of anything within the county's borders that has not been annexed or is not maintained by NDOT. So that includes some higher traffic roads and then unpaved roads all the way down to the agriculture area. So a wide variety of roads were included in the data set. We took that and then analyzed to see if there was an overrepresentation of crashes relative to that criteria. So this is what it looked like in a table. You could see the different categories of crashes, a total of 988, and then the different types. You can see there's percentage kind of ranges throughout with intersections, dark roadway crashes. Road departure crashes was by far the most percentage of crashes that we had in that 5 years. That's the one we want to talk about the most today for the systemic approach of how we collected the data and then what we did with it. So the roadway departure crashes will be the primary focus that I'm going to cover today. There's a map of just the roadway departure crashes. It's hard to see on here, but there's different color for injury versus property damage only. And then the fatalities are in a red cross. So the same crashes that were mentioned in the table on the slide before are now located on the map here. You can see in the lower right hand in the southeast quadrant how there's more crashes in that area. That's definitely the more populated area of our rural roads that we maintain. So you could expect to see more crashes in that area. Then it was split down into a crash tree. I don't know how many people are familiar with all of that, but we took the 988 crashes. You can see that the fatal and injury crashes of those were there was 170 in that same data set. But we went to the non-intersection crashes. There's a large representation there where we didn't expect to see more crashes at non-intersections. Typically, you have the conflicting movements at an intersection. And then as you work your way down in the yellow boxes, I can zoom in here a little bit. You could see that we had non-intersection crashes were a higher percentage than non-curve, so on a straight road and on dry pavement. So we have people crashing on our roads that it's not wet and it's straight and it's not at an intersection. So we had something we needed to address, and we started seeing that when we started kind of bringing this data apart to look at it. And if you look down one more box, it's not highlighted, but 63% of those crashes were in the daylight. So it's not even because it's dark. So we're having a large number of our crashes occur on straight, flat, wide open roads that are dry in the daylight. And it didn't really, that really resonated with us when we saw that. It was like, you wouldn't expect that to be the results of looking at crash data. So we looked at the systemic analysis, kind of what was the connection between the roadway characteristics and the crash data. So then this is where, Laura Slusher was a very big help in kind of trying to put this all together. So we have the clearest connections between these characteristics are higher volume roads. So anything in our case was greater than 1,000 vehicles per day, or average daily traffic. The narrower roads, so 20 to 22 feet in width, and anything that was in poorer pavement condition of less than a 5. So Pacer scale is a 1 through 10, 10 being excellent, 1 being terrible. And everything was less than a 5 would be an overrepresentation of those crashes. And then it was also located in the higher growth areas. So we were able to use the data to determine where this might be or what roads could also be at risk in addition to where we were having hotspot crashes or hotspot areas. So the roadways in this table were what then we were able to determine, you know, where this could be a future issue that we could proactively implement countermeasures to reduce the risk of those future crashes. So some of these roads may have been listed as a hotspot, but many of these roads were not listed as a hotspot. So we took that and then we're able to identify those on a map. And that's what the map, so the blue lines are where you can see that those roads are that we're going to possibly, start seeing the crash possible, the likelihood of crashes could increase because of the similar criteria where we were already finding crashes on straight or wide open roads or areas where they were narrower or had poor pavement condition. So that was I know I went through that kind of quick, but that was the systemic part of how we were able to identify not only where our problems were, but where the future problems could be. So from that, we wanted to, not just, oh, that's good to know, what are we going to do about it? It's, we don't have any money, or, we don't have a clear plan on what to do to prevent those issues. So we took our action items, and this is where you start working with the staff. You could work with, engineering firms or consultants, but in general, we were able to pick it up pretty quick. We didn't have striping on a lot of these roads. They didn't meet criteria in the MUTCD for us to add pavement markings, so we didn't have to. We went and did a no passing zone study to determine where, if we were to stripe them, where we would need to put double yellow lines or, where there was an area that could be a passing zone. Another action item was improve the shoulder conditions on the paved roads. We have very limited right-of-way widths and therefore limited pavement widths where we don't have wide paved shoulders. Many times we have a paved area within a stone shoulder that may be a foot or two, and then it immediately goes to a side ditch. So it doesn't give a lot of opportunity for a motorist to recover if they did catch the edge of the road. One of the other items was install edge striping on paved roads, 20 feet wide or greater. Again, not a requirement in the MUTCD, but is it something that we could help motorists then see the white edge lines and know where the edge of the road is so they didn't run off the roadway possibly? Another item was keeping intersections free of obstructions that block sight lines and the view of traffic control devices. That's one of the items in our plan we've implemented heavily. Install high visibility traffic control devices, maintain minimum pavement rating condition in growth areas, and then develop and implement a countywide sign replacement program. We've pretty much taken action on all of these. This plan was approved in 2020. We've worked on every single one of the action items in here. The biggest challenging one has been the right-of-way widths to do the shoulders. That's proved to be a lot more, I guess, challenging from maintenance perspective, and then acquiring that right-of-way that would be needed in order to do that is definitely proved to be the toughest one. So a couple of things we did on our projects, we were able to use this local road safety plan. We had done a sign inventory and determined that there was a lot of signs that need to be replaced, about 4,500 regulatory and warning signs. So that's yellow with black markings on it, or a yield, or speed limit signs or stop signs. We were able to bid that project, and we were just recently completed it where we replaced all 4,500 signs that were in that condition around the entire county. Another project we recently did with our local road safety plan was we went after federal funds. HSIP stands for Highway Safety Improvement Projects. We were able to obtain a federal grants for that to add striping on roads where striping didn't previously exist. It only has to be on system roads. We recently let that project a few months ago. It has not been completed yet. So we don't know the results of all of these treatments that we were able to do, but we were able to use that local road safety plan to then go execute some of these projects. This one was a hot spot and a systemic. It came up with both of these. This is a road down in the far southeast, right near the border with the county that has Indianapolis in it. So it's getting a significant amount of traffic, still considered a rural area. We were able to, use the crash data, and it was getting about 3 crashes per year over a 5-year period. There was many more crashes. Many weren't reported because there wasn't injuries, but we've frequently picked up car parts and um, cleaned up things with the signs being knocked down. There's utility pole frequently got hit. We did a project to change the slope on the outer radius to make it a super elevated curve, added high friction surface treatment. And we've had 2 crashes total since then. And we're about 5 years out from that project. So we went from 3 per year to 2 in a 5-year period, which is a major change. You can see that we've definitely notified motorists. We tried all this before we actually did the curve correction project. Multiple curve signs, we added lighting, but nothing was effective. We just worked our way up through the toolbox of tools and things to do to try to prevent crashes in this curve. That's a picture of what the high friction surface treatment looks like today. Still doing it, serving its purpose. And it's a project that we're pretty proud of and we talk about frequently. We were so proud of that project, we went right down the road and did another one. Very similar situation. It's just on the other side of where that one's at. Same problem. We had a lot of crashes. It was even more crashes in there. We had actually made the problem worse when we replaced a bridge that's just to the north of this project. But we reduced the crashes from 12 per year. First year we had 3 crashes in the road, but it wasn't at the curve. It was just to the north of it. Then we had 0 crashes, and then the next year we had 1. So we've seen a significant increase just from doing a couple of curve correction projects that was found during our local road safety plan. This is a picture. I mentioned that we did the bridge. If you're looking to the south, which is where that's at right now, and the curve is on the other side of that bridge. Before we replaced the bridge deck was in bad shape and trees were overgrown, so vehicles slowed way down, and there wasn't hardly any crashes. We replaced the bridge, made it better condition, cleared the trees back, and we saw a significant increase in crashes after that. that's what it looks like now. You can see the high friction surface treatment in the curve. We haven't had near the issues that we regularly had with crashes down there due to this project. Part of our local road safety plan, we established our vision to help all users of Boone County's transportation system reach their destination safely. And our mission, which is to eliminate those fatal and serious injuries from resulting from traffic crashes, making decisions based on their ability to reach zero deaths on Boone County's transportation system. We've kind of summarized that up to say just get home safe. We got our entire staff um, focused on getting themselves home safe, getting their loved ones home safe, and it's made a major difference in our department. That was all I had for this one, Jamie. So if you want to take back control, I
Yes,
can.
thank you, Nick. We appreciate you talking about your local road safety plan and systemic safety analysis. We do have a couple questions for you. The first one is whether or not you had any roadway crossover crash data that got incorporated.
That was the challenge that we even had to talk about during our local road safety plan. When we were analyzing the crashes, the way they were put in was lane departure. That meant if you left your lane to oncoming traffic, if you left your lane leaving the roadway, it was all counted as a lane departure. That's been a few years back, and I think since then they've made some changes how data gets inputted into the ARIES system, but we did not have anything specific to roadway crossover crashes.
This next question you talked a little bit about at the end, right after it came in, but maybe you have another example as well. How did implementation of the countermeasures impact speed?
So we did not have speed data specifically with our local road safety plan. We don't have any speed data currently. We've done some traffic data collection ourselves. I think there's getting some more sophisticated data available where it's being collected off of phones and connected vehicles. But we have not been able to. So we've recently just finished the sign project. The striping project has not been done yet. So we don't have a good example of what it looks like after the fact just yet.
Another question is whether or not you use centerline rumble strips.
That is something we've considered, center line or edge line. When most of our roads are so narrow, it would leave a motorist driving on one very frequently. We haven't done them yet. When we start seeing wider pavements where we just don't have a lot of roads that are wider than, that are wider than 22 feet, where we can get a good, 11-foot lane, where they could then drive and not be driving on the rumble strips. We have not implemented that yet. It is definitely something that we talk about quite a bit.
We have a couple of questions that came in about your data that you used as well. So they're wondering if you track ATV and UTV incident data and use that in your analysis.
That's a really good question. The ATV and UTV data, we've recently updated our ordinance to try to restrict some of that. We did have a fatality. That was our lone fatality in 2024, was a UTV turning left in front of a passing pickup truck. We do not have any data for UTVs. That might have to be something that law enforcement would possibly have to share because we do have an ordinance that restricts the use and they have to have a permit, insurance, several other safety features, driver's license, that we could then possibly find out how many we even have actually using the road. We do about 75 to 100 permits a year in our department, but we don't have a significant amount of crash data. I speculate if there was a crash, many of which they wouldn't want to be reporting because they were likely doing something, that they shouldn't have been doing anyway.
So I'm going to ask you two more questions and then we're going to move on to our next presenter just for time. But for anyone that submitted questions that don't get answered, we'll try and come back to them at the very end of the presentation as well. So our next question for you, Nick, is how are driver demographics involved in crashes considered in your decisions to invest in various road improvements?
So driver demographic, I don't know if you're meaning like vehicle types, or if you're talking about drivers themselves, the actual motorist behind the wheel. We do not have specific as far as the drivers go. Um, Really, we're more focused on the the count and the type of vehicles. Really, a lot of our projects really have been based solely on the crash data and the likelihood of future crashes, not so much the drivers or the different drivers that we would encounter. I've spent a lot of time talking at high schools, career day, when they're talking about job fairs. We take that opportunity to get in front of those young drivers. So that demographic of drivers is definitely one we want to try to get in touch with. They're developing those habits. We've definitely spent some time doing that, but as far as the projects that are implemented, they do not have much impact on the demographic of the driver.
And then the last question, you did mention that you use HSIP funding. Were there other funding sources that you used, perhaps SS4A funding?
We have not used SS4A funding. We've applied for SS4A funding, but we didn't have a real good, I don't think, unfortunately, some of the criteria weren't able to be met for SS4A on the type of projects we were going at. We even struggle sometimes with HSIP, and this may sound bad to the listeners, but when you don't have a lot of injuries and fatalities at some of your areas, specific locations, then it's doesn't score as high. But with systemic projects, that's where we've been able to really be really successful with our local road safety plan because it called out those systemic issues. We were able to get funding for those. We've also used state grants. There's state dollars available for really projects in general. It doesn't necessarily identify safety projects, but anytime we do a resurfacing project with state dollars, really with any, we add striping, we add stop bars, we add additional sign replacements. The areas that we anticipate would be a problem in the future. So we have used local funds for a lot of projects, and we've tried to leverage any dollars that we can, that we do get for federal dollars that we can then free up some local dollars to do additional safety projects.
Nick, thank you again for sharing your expertise with us. You have a lot of great experience, and you've done a lot of great work in your county, so thank you.
Thank you.
Next up, we're going to shift to talking a little bit about wildlife collision data, and we have Ian Hamilton here. Ian is a transportation planner who specializes in data-driven safety analysis and multimodal transportation safety planning. His experience includes work with federal, state, and local agencies to develop innovative solutions for safety planning. He has a master's degree in city and regional planning from the University of North Carolina at Chapel Hill, as well as a Bachelor of Science in Geography from the University of Georgia. And he's currently a transportation planner with Vanasshangen-Breslin, or VHB. So Ian?
Thanks, Jamie. Can you hear me all right?
Yes, and we can see your slides as well.
Excellent. So I appreciate everyone joining today. Again, I'm Ian Hamilton, a transportation planner with VHB in Raleigh, North Carolina. And I was telling folks before I got on that I am doing this from the great outdoors in Western North Carolina. So hopefully my presentation on wildlife isn't interrupted by wildlife, but I think this is a pretty appropriate setting for the topic here. And I do want to say I really appreciate Nick's presentation on the systemic approach and risk-based analysis, because this presentation is definitely going to touch on those topics. And I would say that everything Nick just presented on, absolutely applies to the thinking with this project. This just happens to be very focused on large animal crash risk. And so before I sort of dive into the technical details, definitely want to acknowledge everybody involved in the project. So that includes our technical review panel, as well as our project champions at VDOT, Amy and Stephen, our technical advisory committee as well, and then of course the project team. Bridget Donaldson at VDOT and VTRC has been a major collaborator with us. Really glad to work with her. And then of course want to thank all the other people at VHB who've helped support this project and the really great results I think we got out of it. So a little bit of background on the project. This is the result of a wildlife corridor action plan that the Commonwealth of Virginia put together in 2023. And that initial effort identified wildlife corridors for a whole host of reasons. So this is not just focused on highway safety. This was also looking at habitat and wildlife connectivity in addition to safety. So this document and this effort was much broader than just a specific highway safety analysis. But in order to support those goals, the previous WCAP in 2023 did this preliminary analysis where they took crash rates from across the state and compared those with known habitat areas, known wildlife, nexus areas, and identified places where some of these crossings and some of these connections needed to be made as a part of sort of VDOT's overall wildlife planning and in association with DWR. And so this process sort of sprang from that. And so instead of taking, say, a highly crash focused approach, we took this opportunity as part of the WCAP update to look at a more risk-based approach. It's very much in line with what Nick just presented on. And so for those of you who aren't familiar with the Safe System approach, this is a part of USDOT's initiatives and also part of VDOT's initiatives. This is called out in the state's Strategic Highway Safety Plan, or SHSP. And effectively, what you're trying to do is address the risk of a crash occurring rather than necessarily reacting to crashes. And that's not to say that you ignore crash history, but again, as Nick's presentation very well illustrated, you are looking for those areas where the next crash is most likely to occur. And so again, we're reducing that driver risk by proactively focusing on sort of design elements rather than waiting for the crash to occur. And so this specific study, again, in support of the much broader WCAP framework, was developing a predictive model to identify some of those high-risk areas. And this really focused on white-tailed deer and black bear vehicle collisions in the state. So really focused on those large mammal collisions. We wanted to score each road segment in the state with their risk score. And we want to compare those results with the previous WCAP. And then as a part of sort of the overall implementation process, want to draft a methodology to do that cost benefit analysis to sort of identify opportunities where countermeasures would be most cost effective. So looking into the data, as part of the WCAP, there was an extensive literature review, and as you might imagine, a lot of that literature comes out of the western part of the U.S., where a lot of these sort of screenings and methods have already been put in place. And there's a lot of variation in how some of these analyses were done. And one of the big considerations for doing a screening like this, looking for those opportunities, is what is the segment length going to be? What is sort of the study area that you're going to look at to sort of bring the crashes together along with the input data, things like habitat, traffic volumes, things like that. And so we looked at a few different lengths. We looked at half mile, 1 mile, and 2 mile segment lengths, and you can kind of see the results of those mapped. And we wanted to identify really an optimal sample size to determine what would be most effective and most optimal for actually moving forward with the screening to then come up with useful results that practitioners could use for countermeasure implementation. We ultimately ended up as half-mile segments were really sort of the, I guess, a sweet spot. Not only did it sort of give us more finite results, more granular results, but as these tables here illustrate, we really didn't lose much by using this disaggregate, half-mile segmentation rather than the longer 1 mile and 2 mile segments. So you can kind of see here, somewhere between 5 and 10% of segments, sort of irrespective of length, tended to have at least one bear and deer crash on them for our study period. So knowing that our segments, we could get away with half mile and still have both really intuitive results, we then took those half mile segments and then compiled a whole host of data at that segment to determine, identify all the characteristics that ultimately could help us identify risk. And so we pulled in resources from VDOT, from the DMV. Obviously we have the traditional roadway and traffic volume characteristics, number of lanes, lane width, median presence, median width, shoulders. The DMV helped us a great deal with identifying some of these crashes. So as part of the crash form, Virginia tracks deer crashes. That's an option that police officers can select. But bear crashes are not. And so it requires a investigation into the crash narratives to identify either existing or potential bear crashes. And so DMV was a great resource for us. DWR maintains data on some of these wildlife populations, so bear density ratings and deer density ratings played a major role in the study. The USGS has a whole host of resources on land cover, so looking at things like vegetation and impervious surface. Those were really essential. FEMA may be a bit counterintuitive, but FEMA does publish a data set of building footprints over 400 square feet. And so again, in collaboration with the Census Bureau or in connection with the Census Bureau, identifying sort of what is the human environment and not just the natural environment that we could look at. So again, now that we have these half-mile segments, we're able to join a whole host of data and GIS to those half-mile segments for analysis. So our method. We wanted to develop this risk-based methodology and not rely solely on crash frequency. Again, there's a host of reasons for that. One being that these events are relatively infrequent. So there may be a few thousand deer crashes per year in Virginia, and there may be a few hundred bear crashes per year. And so I think Nick's presentation illustrated this great, but when you sort of have these relatively infrequent events, you sort of need to make those connections between the event that happened and what were the characteristics associated with that event, just more clear. And so we wanted a method that could scale by geographic area. We wanted to know what was the highest risk at the state level, at the VDOT district level, and at the county and city level. And we want to focus on risk, not observed crashes. We're using the crashes to inform our analysis, but ultimately when we do our mapping, as we'll see here in a minute, we are mapping risk. We are not necessarily creating a hotspot map of crashes alone. And I'll touch on sort of our method here in a second, but the statistical model that we developed, that helped us develop the importance and weight of those risk factors. So we didn't necessarily need to, use too much judgment. We sort of had this, the method is going to give us, how important is each individual factor to the likelihood of a crash occurring. So we developed 6 different models. After discussion with our panel, we wanted to emphasize total crash models. So we could have developed other models for fatal and serious injury crashes only, or fatal and injury crashes, but ultimately sample size and just the utility of this work, we ultimately settled on sort of that total crash or CABCO model. And CABCO, for those who are unfamiliar, that is just a severity scale for crashes. So K being a fatal crash, A being a serious injury crash, and so on and so forth. And we use a logit model, so logistic regression, to determine the crash likelihood. And what that does is that allows us to sort of create this nice scaled 0 to 1 factor that sort of is very indicative of the probability of an event occurring. And in this case, the probability of an event occurring is that large animal collision. We then developed models for animal types, crash severity, and then facility type. And so you can see that we disaggregated the models into federal aid freeways, federal aid non-freeways, and then non-federal aid roads. And that really helped us out in a few different ways. And you can see those key needs, both countermeasure selection and applicability to low data environments. There's a big difference between the countermeasures or potential countermeasures that are effective and applicable to freeways versus more surface streets and non-axis controlled roads. Things like fencing are most effective on axis controlled roads. And so being able to disaggregate these models and disaggregate these results to account for that was extremely helpful. And the reason we chose to have non-federal aid roads, and so that would be sort of your local functional class or rural minor collector functional class roads, is because typically you do not have ADTs for those roads. Now, your mileage may vary in your state whether you do have ADTs or an ADT estimate, but as part of traditional traffic volume reporting, those don't typically get counts. And so we need a model that can account for roads that just don't have a traffic volume or reliable traffic volume on them. So the results. I'll try to cover these at a high level, but you can kind of see the results here. A lot of very intuitive results. And so these are the deer crash results. And what is associated with increased risk of a deer crash? Higher ADTs, obviously locations where there's a higher deer density. The DWR is mentioned or registered. Very important. Urbanized areas also tend to have an increased likelihood for a deer crash, but I do want to point out that there was a decrease in the likelihood associated with population density and building density. And so while urbanized areas tend to be more populous, perhaps there's more conflicts with, higher traffic volumes and drivers. Those more rural areas and more suburban areas in those urbanized areas are where we tend to see the truly highest risk for a deer crash. Forest and cultivated lands, also very important. One interesting thing that Bridget had called out even before we did this was that, she expected to see deer crashes be more significant in those transition areas between forests and cultivated fields, where deer habitat and food sources are kind of tightly located. And we absolutely saw that in the results. Those cultivated fields and those forest areas where that mix was strongest, that's where we saw the greatest likelihood for a deer crash, all things being equal. And so again, I think just a lot of really intuitive results that we were really happy with both deer and bear crashes. And so I'll take a look at the bear crash results. There we go. And so again, very similar, maybe a few different risk factors, but again, I think Bridget noted that, she would expect to see bear crashes more aligned with more forested areas, and we absolutely saw that in the data here. So great to see sort of some really intuitive results and really sort of statistically significant results as well. So really told us that we were on the right track. And as I mentioned, what this method allows us to do is to develop that risk score across the entire network. So we've got the risk maps where every single segment in Virginia, half-mile segment, has a risk score associated with both deer crash risk and bear crash risk. And then some quick by the numbers. Again, the numbers really supported the outcomes here, where we sort of had this over-representation, as Nick put it, which I thought was great, of deer crashes and bear crashes. So for the top 1% of deer crashes, there's about, or top 1% of segments, we get about 20% of deer crashes. And then about the top 2% of segments for bear, we get about half the crashes. So about 50% of the crashes happen on that top 2% of segments. And so that is one thing I think that this analysis did much better in the WCAP, or just the crash frequency based analysis, where we were really able to capture the risk associated with bear crashes as a part of this analysis, as opposed to just a simple crash frequency analysis. And just a piece of evidence there, segments with more crashes. So if a segment had, over the last 10 years, one or more crashes, those tended to have a much higher risk score. So again, just seeing a lot of alignment between our method, our results, and what the historic crash data told us. So finally, I'll touch on our benefit cost methodology here as a part of the output. We wanted to do that guidance to help practitioners actually implement these results. And so as part of that, we estimated the typical cost associated with a large mammal collision. And so this is based on 2025 VDOT crash costs. You can kind of see that here on the right. We're using the comprehensive crash cost field based on 10 years of crash data. And for reported crashes, we ended up seeing about $90,000 for the typical bear crash and about $48,000 associated with the typical deer crash. That said, there is this issue of unreported and underreporting of crashes. So based on some of Bridget's work and others' work across the country, there's upwards of about a 10-to-1 discrepancy between deer-related insurance claims in Virginia and about, a tenth of that actually showing up in the police crash records. Carcass removal data obviously also highlights this discrepancy, but carcass data aren't necessarily available statewide. So we wanted to modify the benefit cost methodology to account for this underreporting. And so what we did is we created what we called factored crashes. So again, being conservative based on this sort of known underreporting, we assume that there are about 5 times as many deer crashes, PDO crashes in particular, so property damage only, as what police reported crashes indicate. And we assume about 3 times as many bear PDO crashes as records indicate. And so what that does is that does water down the average cost by crash type, because instead of having some of the more, higher cost, higher severity crashes, you're having PDOs. But even then, we sort of had this adjusted crash cost by animal type, where bear are about, 44,000 is a typical crash cost for bear, and 24,000 for a typical crash cost for deer. And even if you do have these sort of more realistic crash costs, or maybe sort of factored crash costs that consider the underreporting. If we do assume that there's 5 times as many deer crashes happening, there's greater benefit to doing this, right? You're going to see a greater benefit for 5 times as many deer crashes at $24,000 than you would at the $48,000 for just using reported crashes. So absolutely a benefit to considering things that way. And finally, the supporting tool, the results can be made available via that interactive map. VDOT has a history of doing this with their pedestrian safety action plans. And so hopefully we can have this as part of the WCAP. And then we're also developing a supporting spreadsheet tool that will allow users to apply those model results, use those updated crash cost estimates, and help determine where some of these countermeasures like fencing or improving a underpass or overpass could really benefit the state and safety in the state of Virginia. So with that, I think I'm happy to answer any questions, but if there's anything I can't answer, I'm sure Bridget and Amy would be happy to help you out. So thank you all.
Perfect. Thank you so much, Ian. And we did have a couple of questions that came in for you. The very first one is, did you have to pay for the DMV data?
We did not, and I think that is a function of the fact that we are working for the state, but we did not have to pay for that Virginia data.
We had a comment that came in as well that just said that benefit cost analysis is very important. So thank you for including that as well. And
Absolutely. Thank
then we had a question asking whether or not this report is available already to the public outside of Virginia. And if so, if you could provide a link.
Great question. We're hoping to wrap things up Q1 of next year. So I think we expect to have sort of a final report that can be shared with the public maybe March, April timeframe of 2026.
Perfect. Well, thank you. That was all the questions that we had for you for now. If anyone had any additional questions for Ian, just drop those in the Q&A pod, and we'll get to those towards the end of today's presentation. So thank you one more time, Ian. We appreciate you being here. Our next presenter is Dr. Clay Mann. Dr. Mann is a professor in the Department of Pediatrics at the University of Utah School of Medicine. He completed a PhD from the University of Texas in preventative medicine, 2 master's degrees from the University of Utah, one focused on statistics and epidemiology, and an MBA. Dr. Mann has authored or co-authored over 200 peer-reviewed research articles dealing with traumatic injuries to children, trauma system evaluation, cardiac and trauma resuscitation, and the role of emergency medical services in healthcare. He currently serves as the principal investigator for the NEMSIS Technical Assistance Center, and we're excited to have him here today to talk a little bit about how we can use NEMSIS as a data collection tool. So, Dr. Mann?
Yeah, thank you. It is a pleasure to be here. Can you hear me okay?
Yes, and we can see your slides as well.
Great. Wow, what great presentations, and really highlighting the importance of being able to surveil geographic areas for motor vehicle crashes of different types, and then turn that into meaningful information that can garner funds. What great presentations. My job, hopefully here just in the next couple of minutes, is to describe to you a potential source of data that is ubiquitous across the United States and is available at low cost or free, that may allow you to look at motor vehicle crashes in areas where perhaps you felt like you did not have available data. So my job today is to kind of describe the EMS data, the emergency medical services data that is standardized across the country, and how you might be able to make use of it, and is it of value? And so let's go ahead and kind of dig into that. I think there'll be 2 takeaways. I really do want to spend some time describing the National EMS Information System, because it truly is an information system. But then is that data reliable and valid? Is it something that you can use to actually collect data over time? Is it correct data? Can it be validated and considered reliable? And then how quickly is that data available? I think that's the other area that will be of great interest, I think, to this crowd. One other thing I'll just mention is that NEMSIS provides another method for looking at injury severity, and we'll talk about that as well. It complements, I think, CABCO, and we can talk a little bit about that. Well, the real value of NEMSIS, right? We standardize the documentation that's used to collect medical information for all patients that call 911 and request service. We have standardized that across the country, provided a standardized data dictionary, but really the true value is that we've kind of provided that computer technology, the beating heart of every software product that's used by EMS providers to collect patient care data. And we test every single vendor across the country for compliance to that standard. So the data is standardized across the country, which means it can move across the country very smoothly and easily. So this is kind of a busy slide, but I want you to understand the collection of this data because I think it can be incredibly helpful when you think about using the data. So patient care reports are represented by that square in the middle. The EMS provider is collecting the data, medical device data flows into the record. Then that record, when the provider is done caring for that patient, they press send, and it always goes to a state database. So when I show you the national data that we have, just know that exact copies of that data is available within your state. And I'm going to talk about how to access that. If I'm tracking how quickly this data moves from, say, my living room, if I was to call 911 and have them respond here, it's once they press the button, it's about a 7-minute response time before that data. I'm here in Salt Lake City. We get to the Utah repository at the Department of Health, and then it would end up in the AWS instance for NEMSIS within about 7 minutes at the national level. So the data is available at the state level very, very quickly. Does all the data come in that early or that quickly? No, probably not, right? If I pulled some data in October here, just looking at the number of records that we're receiving per day. You can see that with the green bars. But I draw your attention to just the red square there on the bottom left. We get about 25% of records that occur on any given day in the national database in about 8 hours. We have about 50% of the records that occur on any given day in about a day. And really, 3 days to a week, we really have a complete data set. So within your state registries, you have complete data that is available like on a weekly basis. What is our coverage? Every state uses NEMSIS, all states, the District of Columbia, 3 territories, they all use the data. We collect about 60 million EMS activations per year. You can kind of see there that the last years we've really kind of hit the ceiling where I think we're collecting basically all of the data across all of the states. We'll collect 61 million this year because of a couple of regions in California. So really, I think the data for crashes where EMS responded are available within your state repositories and are worth seeking. Let's talk a little bit about the accuracy or reliability of NEMSIS data, right? If I was sighting in a rifle, right, I would want my rifle to be accurate and reliable, not the upper left square. I would love to have the lower right-hand square. And that's what we all strive for in our data, right? That it's going to be the same every time, reliable, and that it's going to measure exactly what we want to measure. I'll call attention just to the top right a little bit, where you have a rifle that is incredibly reliable, but not exactly on target. That will be important when you're thinking about NEMSIS data, and I'll draw your attention to that in just a minute. Just to frame up for you kind of how NEMSIS data has kind of proven to be a really good marker of what's happening within communities. I'm just going to draw your attention to using NEMSIS data, EMS data, to track influenza-like illness symptoms during the COVID pandemic. So influenza-like illness symptoms before there was a diagnosis for COVID that could be given in our homes. It was just called ILL. We were tracking influenza-like illness symptoms, and that ended up being COVID. And I just want to draw your attention to the years that we have there in color, and then the calendar weeks on the x-axis, and then time periods in the year 2020. You can see over time would be the red bar, and then all of the bars 2 years before COVID, and then years after COVID until the first quarter of 2023. But what's interesting you could see here with this data, right, is when the CDC announced community spread in February. You can see how the NEMSIS EMS calls, 911 calls for, I'm suffering something that's like the flu. Could this potentially be COVID? And you can see how we just had that incredible rise. And then during the period when states initiated stay-at-home orders, you can see how we were able to kind of get it under control. You can see how we got into the later months, how it just took off again. Anyway, it just gives you a great idea, right? Is if you're watching EMS data within your communities, it's going to give you a handle on what's going on. Is it always direct? No. And this is an example of that upper right-hand corner I was talking about, is something that's very reliable, but maybe you need to tweak it to get it to be center of the target. So here's a great example. So here's FARS data in blue, looking at motor vehicle versus motorcyclist crashes across the years 2018, 2019, and 2020. So you have in blue the proportion of fatalities over population, and you're right on the y-axis. NEMSIS data is total motor vehicle crashes versus motorcyclists over MVC activations. So kind of just what proportion of the EMS records related to motor vehicle crashes are related to a motorcyclist versus car. And even though they're measuring two different things, one is just the frequency of EMS calls and one is actual fatalities, they just track each other very, very well. And you can see how during 2020, when we know high-speed crashes became more frequent and more deadly, you can see how the difference in the EMS data versus the FARS data. But interesting, I chose motor vehicle versus motorcycles because it is very seasonal and cyclical, but yet you can see how, even though you're measuring two different things, the NEMSIS data could be very helpful in tracking types of motor vehicle crashes. And of course, the real value, the FARS data is available in 1 to 2 years, where the NEMSIS data could be made available on a weekly basis. So a real advantage in regards to surveillance. Let's talk a little bit about what NEMSIS can provide, because you have a healthcare provider showing up on scene. They can provide you probably a much clearer picture of injury severity, something that I think we've all wanted across our industry, right? We do a good job measuring fatalities, but how can we improve our ability to identify truly severe injuries? We have lots of data within a patient record that can help describe the physiological stability of a patient. Are they hemodynamically unstable? What type of injuries did they suffer? Lots of variables that will help us. And I'm gonna walk through just a couple of those quickly. So we see kind of 3 ways to measure injury severity where you could use the EMS data within your state, within your area. One is kind of time-sensitive care, where we have providers, they provide an initial patient acuity and a final patient patient acuity. Is the patient critical, or are they stable? You can also look at the NEMSIS data to determine, did the EMS providers think that this was a serious injury that needed trauma care, right, and needed to get to a trauma hospital. And then finally, you can use a physiological measure called a revised trauma score, which I'll describe just real briefly, and determine the severity of their trauma, and then also even look at the probability of survival. So let's talk a little bit about that. So this is, I think, as Ian was talking about the value of CABCO, I think this is adjacent to CABCO and may provide you with a little bit more specificity in regard to injury severity. Ian talked about the different categories that are measured by police officers in regards to CABCO. Their definitions can vary a little bit from state to state, so it would be important maybe to look within your state how CABCO is calculated. And it's really the police officer, kind of assessing the scene and the patient. A revised trauma score is probably a little bit more sensitive and specific in that it utilizes vital sign measures, so a Glasgow coma score, systolic blood pressure, respiratory rate, and the providers will gather that data, and then a revised trauma score. It's just a linear model that was developed a lot of years ago, a regression model, weights the value of each of these measures. A Glasgow coma score is a measure of your consciousness. Are you fully conscious? Are you partially conscious? And then that data was exposed to a famous study called the multi-trauma outcome study to determine a probability of survival based upon the EMS's first arrival and collection of vital signs. So this is if a patient were to calculate on a coded value of about a 2 for revised trauma score, that equals about a 36% probability of survival. So it can be incredibly helpful to help you determine where your severe injuries are occurring. Another great way within NEMSIS is on every severe injury, the providers will indicate whether or not there were criteria that needed to be met for the patient to be transported to a trauma center. And there are 4 categories for that, and these data are in your NEMSIS file as well. There are measures of physiology like we were just talking about, right? If a provider clicks any of these values, it means yes, the patient does need to get to a qualified trauma center, level 1 or level 2. So these are severe injuries. So you have physiologic measures based on age. You've got injury patterns, right? If a patient has a suspected pelvic fracture in association with the motor vehicle crash, they should seek trauma care. And then the 2 other measures are related to mechanism of injury that would suggest that the patient needs to be transported to a trauma center, and then also just EMS judgment, look at special situations. But if you look at mechanism of injury, really the bulk of these are related to motor vehicle crashes. So there is great data, I think, in the NEMSIS database that could help you determine why the provider thought that this was a severe crash and needed types of care. So let's look just at an application of the data a little bit. I'm going to show this with the same graph that I characterized associated with influenza-like illness. And you can look at the motor vehicle crash rates using those same measures. So when community spread was announced for COVID, when the states began to initiate stay-at-home, and you can see we all are familiar with that reduction in motor vehicle crashes that were associated with that time period. But also, as we know, injury severity for that year 2020 also just peaked with empty roads and people being involved in high-speed crashes. and importantly, that's been reported by NHTSA and other folks was the stark increase in the number of ejections of patients during that time period. So again, this is national data, but clearly state data is available. It's available now. It's a week old, and we can make data available for lots of geographic areas within your state. There are some dashboards on the website that I'm just going to show you real quickly, where you could potentially go and begin to get a look at the national level and look at your state level data. So for state level data, you need to request access to the data from your state EMS bureau or office, and I'll help you kind of see where you can find out who that person is, where you can request that data. But let me just show a little bit to you, just a couple of those dashboards. So I'm going to jump over to the NEMSIS website. I'll go back and show you where you access this dashboard. So if I just go back to the NEMSIS website, go to View Reports, Public Reports, NEMSIS Dashboards, and this is just at nemsis.org. And I'm going to go down to the 2 motor vehicle crash dashboards. I'm first going to look at just the crash dashboard, and then I'm going to look at the crash severity dashboard. So if I go here, I go to this public dashboard that shows me during each year. You can see it always includes an active year. This is as of the 19th of this month. We have about 1.4 million crashes across the country. This dashboard is available to states with a password protected password. And we do that because our DUAs with states don't allow us to release any geographic data to the public. And so a state data set has all this information plus a map down here for the state that indicates where these crashes occurred. So you can ask for permission to this dashboard, or folks in the office know that if I'd like to create, you know, a visualization of this dashboard for a certain county or for someone who requests the data, it will automatically produce that once I've created the report that I want. So if I go back to the dashboard, as I mentioned, it'll have all the crashes. Yours will have those for the state. You can choose a type of injury. Let's say nationally, let's choose just motorcycle crashes, for example. Oh yeah, I did that wrong. I apologize. Let me choose only motorcycle crashes, and I'll apply that. Everything in the dashboard will change to represent that. I can look within your state. You could look at rurality, right? That's based on USDA urban influence codes. I can look at rural areas across the country. And of course, for your state, everything here will change. You could see when your crashes are happening, how many are happening based on this. So this is motor vehicle crashes by month. Scene response time, probability of survival for those patients. Of course, NEMSIS data isn't a good measure of fatalities, right? Because a patient could die after EMS care, or EMS may not even be requested in some circumstances. We could look at the patients where they admitted to alcohol use, and everything will change, right? So now I could actually look at, you know, when are these happening? Well, they're Saturday night, 6 p.m. to 12 a.m. It can help you really pare down into the data that's happening within your state. So this would be available. You need to contact your EMS office to see if they can run you off a PDF, or if you could be on a screen share with them and look at your county or your state. The data is available by county. I'm going to go to the other dashboard. So I would just go back to the same location. I'm going to go back and just make sure that you were able to see that process. So public reports, NEMSIS dashboards, and there was an injury severity dashboard there as well. So that's That's based on the probability of survival, which is listed here, and then whether or not the provider initially would assess the patient for acuity, and then also they have a final acuity before they drop them off at the hospital. So again, for your state, it's the same thing. If I wanted to look at motorcycle crashes across the state, I could choose certain age groups. I could choose rural areas, again, within your state. And again, there would be a map that would be present here. You can look also at, let me get this scooted up a little. We can look at those trauma risk factors that I talked about. So if I choose the trauma risk factors within a state, you'll be able to look at what risk factors are, what are your types of injuries are your patients suffering. And you can see it will maintain those values that you chose at the beginning of the first tab. And now I can determine, wow, within the first quarter of this year, right, it was due to, bad physiology or, types of injuries that happened, for these motor vehicle crashes. All the things here will be present for you to be able to define what were the types of injuries that were present. So really a lot of flexibility in regards to use of NEMSIS data to evaluate motor vehicle crashes. I'll go back to the opening page to determine where you could access this data. All you need to do is to go down to the map. If I click on my home state, Utah, it will bring up Felicia Alvarez's email, and you'd be able to contact Felicia and ask for the state to provide you with case level data associated with motor vehicle crashes within your county or your area. Or you could, if your state has some trouble providing you with data, you could reach out to your representative within your state and they can provide permission for the NEMSIS TAC here at the University of Utah to be able to cut you a data set. They just need to send the EMS director or the state data manager just needs to send an email to us, and we will contact you and be able to send you that data. So I'm hoping that folks have had a chance to potentially use or access NEMSIS data. And I will quickly here go back to the presentation just to sum up. There's lots of research that's been done with the NEMSIS data, and feel free to access that. Again, if you wish to access NEMSIS data directly from us, there's a location on the website to do that. I'll show you that real quickly. Just request research data here, and then we can provide the yearly data set to you. I will remind you there is 60 million activations in here, so it is a wieldy database to use. But if you're interested in only your county or your region, you can talk to your state EMS director or your data manager and say, I'd like to make a request. Can you get me the data, or can Clay get me the data at the National Technical Assistance Center? We fill hundreds of data requests per year. There's no cost for requesting the data from us, and we would be happy to make it available to you. So I will end there and see if there's any questions, and save us time for a wrap up.
We do have a couple of questions for you, but I think the biggest one is about how to go about asking for the data. And you've talked a little bit about requesting it from your state EMS manager. Do you have a link on the NEMSIS website that has contacts for each state's EMS managers?
Yeah, I think you would just go to the NEMSIS website, to the opening page, and then you just have to click on your state. So I'll do that one more time. Just come down here, say you are from Wyoming, you just click on Wyoming, and Jay's information will pop up, and that's where you would request the data from your state. So
Perfect.
just hit
Thank
this
you.
map. Yep.
And then there were some questions too. I know you spoke a little bit about it being able to be requested from a state partner, but what about a non-state partner? So if they were at the local level or the county level, they're also able to request this information for within their state as well?
That's right. That's right. Because as the state has your full data set, the exact same data that we have, just due to the fact that we don't accept data from an agency or a region. We only accept data from the state. We require full data sets at each state. So if you're from a county or a rural area and you call your state data manager and say, I want to know all of the motor vehicle crashes that happened in my county. NEMSIS data goes back about 10 years. We went from a version 2 to a version 3 data. Stable version 3 data across states goes back to about 2017. So clearly you have a lot of years data that you could request from your state. And again, some states have really well-oiled machines for cutting smaller data sets that could be Excel files or things for small requests for data. Some states are not quite as sophisticated. And in those cases, all you need to do is tell your state data manager that I would like to request the data, and if the state can't provide it, and if they could just provide a note up to the Technical Assistance Center to cut the data for the requester.
Another question, I think that I posted this link, but I'm just going to ask the question just in case to make sure this is correct. But someone is mentioning that they clicked on the dashboard and need to have an account. How could they get that account so that students at a university could do research? I believe you mentioned there was a request research data link that I dropped into the chat, but if that's not the right answer, if you could just go over that one more time as well, please.
Yeah, that's a great question. So yeah, you can request the data here, just request the research data, and this will be the large case level 60 million point data set. The good point that the questioner asked was, yeah, you're right. If you try to hit the state reports, right, and I want to do a state report where I have a geographic location of all of my crashes. It's right here. I'm sorry, I'm going to go up just a little bit. Where's the motor vehicle crash? It's right here. But if you try to go here, you have to have a sign in. And that's where we weren't allowed to provide geographic data, because there'll be maps here showing where the crashes happen. So again, if you want to be able to look at a specific area, you would contact that data manager and say, hey, can you cut me a PDF just like I showed you for Cook County or for Uintah County? Then they'd be able to do that, snapshot the data for you, or they could provide a password for you to be able to access and use the dynamic map. Depending on the states, will just be how comfortable they are kind of releasing passwords or just providing you with views once you build the map that you like.
We have another question for you as well. So if someone is able to get access to this EMS data for the state, is it possible for them to link it to a state crash report using some type of unique identifier for the victim? So whether it be a social security number or driver's license number or something else?
Yeah, wow, these are great questions. There is no specific identifier that flows between crash records and EMS records. That's something we're trying to fix right now with what we're calling a universal unique ID. It's really not in place yet. We're hoping in the next couple of years it will be, so that there's a UUID for the NEMSIS record on a crash form. that's in the works at NHTSA. But no, right now I think the research that I've seen that uses forest data will match on day and location to quote deterministically link the data, right? I think crashes within specific locations are specific enough that it can be a deterministic match. Maybe if you're looking at larger areas, it might have to be a probability match, but there's no unique identifier yet.
Another question that was asked for you as well is, does disability get identified in the records? They mentioned that in their area, they have a problem that the crash reports don't reflect if a person was vision impaired or in a mobility device. And they've seen a lot of crashes around hospitals, so are wondering if your data set may have that information.
Oh, that's a really good question. We do have what we call delay elements. As you may think, time for EMS is like their most precious commodity. So there's lots of NEMSIS elements related to why was care delayed, and there is an element related to on scene where a provider can indicate that patient care was slightly delayed because of a a disability that the patient may be experiencing. But an assessment of all patients, no, but it may be captured in part in the delay element, the scene delay element.
And the very last question that we have for you today is, are there GIS data sets available as shape files and its components for download?
Yeah, another great question. So that would be data at the state level. We talked about geography is not, we can't release the geography nationally, but yes, most of the software that houses the state repositories has a very detailed mapping. So yeah, if you work within your state EMS bureau, through your highway traffic safety board or some other kind of access, contacting them directly, they'd be able to answer those questions for you. And yes, they collect the very lat long of the crash, or they will have a complete address. There's a place in NEMSIS to indicate that, I'm near mile marker 61. Lots of different ways for them to identify a location.
Thank you, Dr. Mann. And I want to take time to thank everyone for asking questions today. This has been a very, very good discussion. I see that everyone is, there's been a lot of different data sources we've talked about today, and everyone seems very engaged. So I appreciate all the questions. I really sincerely appreciate our three speakers being here today to answer questions and share their expertise. So one more time, let's thank Nick, Ian, and Dr. Mann. Very appreciative for you guys being here. The recording, we had a couple questions about that. Typically, our recordings are available within the week, but with the holidays coming up and some vacation with different staff that need to take care of posting it to different places, it may be after the new year, but we will send an email out once we have it posted. It's always on our website at ruralsafetycenter.org under the training dropdown on our webinar archive. Again, we will send out an email once that recording is available. Thank you all for joining us. Happy holidays to everyone. And one more big thank you to our speakers. Have a great afternoon, everyone.